Okay, so with part two, we're going to talk about muscle tone. We might have talked about this already, but to talk about it again, muscle tone, it's an important concept. And then all these different reflexes within the body. What I mean by reflexes, we'll get into that in a second. Um, with muscle tone, you have low muscle tone or high muscle tone. It's kind of what it says, the low muscle tone. You see this a lot with children, certain diagnoses. Think they're kind of floppy. It's just really loosey-goosey. Down syndrome, individuals with Down syndrome, I think, is a good example of that. They have a hard time functioning because there's just not a lot of stability there, not enough tone in their muscles to do what they want to be able to do. These are kind of extremes in this low-tone baby. And then the opposite on the other extreme is hypertonia or high muscle tone. You get into this spasticity. Somebody has a stroke, somebody has cerebral palsy. Usually it's brain-related damage that causes this. The brain, believe it or not, regulates the tone, the amount of tautness in your muscles. And in some cases it's extreme, and it can really impair somebody's function like this. And as you can imagine, or cerebral palsy, it's hard to do the tasks they want to be able to do because there's so much tone in their muscles. So really what you need to know now is just there's a difference between high and low muscle tone in those terms, hypo and hypertonia. Okay, reflexes, what I mean by reflexes, these are things that just happen automatically. You're born as a baby, if you're born healthy, with these reflexes. Your body starts to integrate a lot of these reflexes as you get older. In some cases they don't, though. This is kind of where you get OT to help the body integrate these reflexes. Because again, it can interfere with somebody trying to do a certain task because the reflex is overwhelming. You also see a lot of these reflexes or different kinds of reflexes when somebody's had damage to their brain, and almost kind of goes back to when it was a baby in a sense, and these reflexes start to dominate their movements. What are examples of reflexes? We'll just touch on some of them. This is something called the flexor. You may be familiar with this one. Flexor withdrawal reflex. Kind of manifests in different ways. But this one, as a baby, just touching the bottom of this foot causes it to flex. So here it is, the leg is extended, and somebody's touching the bottom of the foot, and it causes them to flex. What I mean by flexing, they're flexing their knee and their hip, kind of pulling their leg up. It's that kind of withdrawal thing. And it's an instinctive kind of reflex. It happens without conscious control of it. This is a baby, has no control at all over their movements yet, but when you're touching the bottom of the foot, it will do that. Another example is that grasping reflex, you may be more familiar with. You take a baby and you touch the middle of their palm and they will just close into a fist. This is done for instinctive reasons, for hanging on, and other reasons, in evolution. But it's another example of these reflexes that just kind of dominate and just kind of automatically happen without consciously controlling them. Here's an example of the flexor withdrawal. This is around pain. We all still have this one. So like you step on something sharp, like a piece of glass, and boom, you just instinctively go into this flexor withdrawal. It shows you the whole physiology of it. You don't need to know for this class. You probably look into that again with neuro in the spring. It just goes up to the spinal cord, and this response, your body just automatically responds. You don't even think about it. It just happens. It's kind of like if you get your hand burned, you just boom, pull it away from the stove without conscious thought of it. It's an automatic kind of movement. Other reflexes, some of the ones you need to kind of get down for babies. Positive supportive reflex. Pressure on the ball of the foot causes rigid leg extension. You see that the leg extension there when they're walking. Crossed extension reflex. One leg extends, the other flexes. Again, it's just kind of happening automatically. Extending, flexing. It's almost like part of walking and starting, but it's not, functional walking, but it's just like this reflexive kind of thing. And you see this one too with stroke patients. They will just automatically do this without even realizing that they're doing this. And here's the kind of the mechanism, neurophysiology of it. This is a common one called ATNR, asymmetric tonic neck reflex. Turn your head to the side, arm extends on the same side, opposite arm flexes. So as this baby turns their head to the right, this arm extends and this arm flexes. So if he turns his head to the left, it'll be the opposite. This one will extend and this one will flex. And this is like an automatic reflex. And babies do this. I remember my son was born, he did this. One of the things the doctor was checking right off the bat was these reflexes. And I was watching him doing it. He says, "Wow, you're checking out his reflexes. They look pretty good." And the doctor was like, "Oh, you must be an occupational therapist because it's something you have to do, working with children, and you have to know about these reflexes." And when you take your upper level pediatric classes with Chris, Dr. Hubbard, she'll talk about how to integrate these reflexes and how to help children that have a hard time integrating them. Because if you think about this, when you say you're older and you're trying to function, every time you turn to the head to the right, if this arm extends to some degree, it's going to be hard to do really anything functionally. Other reflexes is the symmetric tonic neck reflex. If you pull your chin from here to your chest, the upper extremities flex. He's flexing his elbow and his hands, and the lower extremity extends. Another kind of automatic response. The tonic labyrinth, can't demo that, but as they flex their head, the extremities flex. So it's going from extension to flexion. And then if you extend the head, the extremities extend. So here, extension, extension, flexion, flexion. Here's again, extension, extension, flexion, flexion. This is just, again, another automatic response that the babies, all healthy babies should do. Okay, so that is the reflexes, and this is kind of what's coming up in the labs. That last quiz, and then the last practicum, 11:20, which is our next to last class. That's on a Friday now, 11:20.